Capstone and 5-year plan for the baccalaureate program at Lamar University. I'm Corrinne and I'd like to provide you with my bio sketch. I graduated in 1986 from Southern State Community College as a licensed practical nurse. I returned to Southern State and graduated in 2002 with an associate degree in applied science in nursing. In 2008, I was certified as a certified professional coder, in 2010 as a certified ambulance coder, and in 2012 as a certified ambulance compliance officer. I will graduate with my Baccalaureate of Science in Nursing from Lamar University in May of 2018. I'm currently employed by a Medicare administrative contractor as a provider outreach and education consultant. I provide education to nurses and physicians on the Medicare benefit and policies and documentation to support the services they bill to Medicare. My hobbies include photography and playing competitive poker. The goal of the Lamar University RN to BSN program are to provide excellent learning opportunities to prepare graduates to meet national standards for entry into practice as competent, professional, registered nurses. Lamar achieves these goals by providing classes and assignments that are part of a BSN organizing framework constructs shown on the screen and 7 learning outcomes within this framework. I will discuss each of these constructs and their learning outcomes in this presentation. The Humanity and Society construct learning outcome prepares the RN to practice safe and effective holistic patient-centered care to a variety of patients, clients in multiple settings from a global perspective by incorporating theories and evidence-based finding. Nursing Class 4540, Nursing Practice Care of Communities, meets this construct. This course required an assignment titled Practicum Project Planning and Windshield Project. This is one of the most eye-opening assignments that I completed during the program. The assignment involved looking at our community and available resources, landscape of the community, different diseases or potential for disease or hazardous health issues that might be prevalent in the community in which we live. During this class, we also participated in the discussion forum on global health problems. This assignment included evidence-based findings on global health problems. I feel this goal was met at 95%. The Lifespan Health Continuum construct, the learning outcome is to provide education that supports patients, clients in preventing disease, maintaining wellness, and promoting and restoring health and advocating for the death with dignity. This objective was met with Class Nurse 4540, Nursing Practice Care of Communities, and Nurse 4316, Comprehensive Holistic Health Assessment. The assignment, Community-Based Service Learning, was an assignment in which we looked at organizations that focus on providing community services. The Practicum Project Windshield provided education within the community and identifying resources for maintaining, promoting, and restoring health. Throughout both of these assignments, I focused on the special needs aggregate of hospice patients, which provided me with a better understanding of the hospice patient's needs and death with dignity. The Shadow Health Interactive Learning Tool used in Nurse 4316 increased my skills in patient assessment and obtaining a patient history. I thoroughly enjoyed using the Shadow Health Interactive Learning Tool because it provided me with an opportunity to enhance my communication skills in taking a history without the awkwardness and clumsiness feeling in front of a patient. I felt that this goal was met at 100%. The learning outcome for the Lifespan Health Continuum construct is the nurse to evaluate patient-centered care for patients, clients, across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This construct was met with Class 4620, Practice, Comprehensive Multiple Health States. The most memorable assignment that met this criteria was the Practicum Reflection Paper. Throughout the course, there were several discussion assignments that were relevant in evaluating patient-centered care and assessing patients with compromised multiple health states, which was very helpful. However, the practicum paper really helped to pull all the knowledge together. The other insightful information was that I chose a person that I knew with a chronic health issue and was able to gain insight into the disease process, and it was really more meaningful. I rated that this goal was met at 98%. The learning outcome for construct evidence-based practice and clinical reasoning is the nurse will synthesize clinical reasoning and judgment in nursing practice utilizing critical thinking, nursing processes, research, and evidence-based practice. This construct was met with Nursing Class 4390, Nursing Inquiry Evidence-Based Practice. The assignment, Peer Collaboration, was an assignment performed by a small group where we were assigned to critique a research article and submit a single APA formatted paper on our findings and critique of the article. This assignment did not only provide education for research and evidence-based practice, but also provided for collaboration among teammates in order to complete the assignment, which is an important skill set for a nurse to develop. Nurse 4390 also required discussion topics which assisted in synthesizing clinical reasoning and judgment in nursing practice. I rated that this goal was met at 100%. The patient-client-centered care construct's learning outcome is for the nurse to employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with the patients, clients, and members of the interprofessional and intraprofessional healthcare team. Nursing Class 4321, Nursing Theories and Online Education, and Nurse 4316, Comprehensive Holistic Health Assessment, met this construct. The assignments that were relevant to this construct was a professional nurse liability APA paper. This assignment provided a common scenario in which a patient fell during a hospital admission. What I enjoyed about this paper was the fact that I was left to use my own creativity to control the scenario and the outcomes based on the information that I learned in nursing theories and evidence-based findings. During this assignment, I had to evaluate the levels of nursing and how they applied to the differentiated essentials competency known as the DEX. This assignment also required that I demonstrate knowledge of the Texas Nursing Practice Act and the Texas Board of Nursing rules for emphasis on safety and nursing liability. This course also required a focused insight essay for the assignment. For this assignment, we were asked to write an essay on a situation in which system theories have influenced a multidisciplinary approach in our own work area. Class 4316, Comprehensive Holistic Health Assessment, provided instructions and learning through Shadow Health. I rated that this goal was met at 100%. The professional role. Construct's learning outcome is that the nurse will be able to differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients, clients, as a member of an interprofessional and intraprofessional healthcare team. This learning outcome was met with Nurse 4550, Nursing Practice, Leadership and Management, and Nurse 4321, Nursing Theories and Online Education. Course 4550 required a leadership paper to identify effective leadership. The nursing profession offers a variety of levels of nursing. It's important to understand and differentiate the multiple role dimensions and practices. This paper provided me with the opportunity to research and reflect an effective leadership style, as well as research and understand the ethical and legal parameters of the different roles in nursing. The APA style paper on professional nurse liability required me to differentiate the multiple role dimensions in nursing and apply the differentiated essential competencies. This assignment also emphasized the nurse to demonstrate knowledge of the Texas Nursing Practice Act and the Texas Board of Nursing rules with emphasis on safety and nursing liability. I rated this goal was met at 100%. Another learning outcome under professional roles is the nurse will demonstrate professional integrity, effective communication activity inquiry, and service to the community. This outcome was achieved in Nurse 4540, Nursing Practice Care of Communities. The practicum teaching project assignment provided education and instruction for the care of communities. The project required that we select an at-risk aggregate population and develop education for disaster preparedness. I'm currently a hospice education consultant for a Medicare administrative contractor, and one of my regions is Puerto Rico. This assignment was very timely and had a profound effect for increasing my awareness of preparing for a disaster. I rated that this goal was met at 100%. Oh, my 5-year plan. First of all, I'm going to be enrolling in a management and leadership training program with my company. I also would like to obtain a master's degree in nursing in the next 5 years. And I'm also going to start exploring opportunities to increase my presence in a management role within my company. Here's the references for today's presentation.